With the blessings of God, let me start. So today we are going to discuss, as per the council guidelines, we have to discuss, we can take any disease and we have to discuss its etiology, pathogenesis and give a protocol for treatment. So we are going to, it's going to be a very practically applicable session. Although there will be lots of theory, but you will get something good by which you can go back and start using this knowledge on treating your heart patients who have got blockages and save them from going for bypass or angiography. So otherwise what happens is many people tend to think that acupuncture is something for just pain and paralysis, but we understand that it is not. We have seen the great results that Dr. Lohiya has shown us in various almost impossible cases, and we are inspired by that. And I would like to also say that this topic is very close to my heart, literally, although no pun intended. And because when I was shifting from my allopathy to holistic medicine, there were many people who were raising objections. They were saying that there are many things like heart blockages and all. How can your acupuncture cure it? So, yeah, at that time there were no precedents. I had not heard anybody getting cured of heart disease through acupuncture. So, but it got me thinking. And I just happened to see a book, a small little book. I think it was by Dr. Dean Ornish, and it was reversing heart disease or bypassing the bypass, something like that. I did not even touch the book. I just saw the topic. I said, okay, that means it is possible. And if it is possible, then I will do it. This was my philosophy. If something is possible, I am going to do it. If it's impossible, then of course. So that's it. And then with the knowledge we received from our acupuncture teachers, I was able to understand what is, how we can actually reverse heart disease. So let us look at that now. Yeah. So why is heart disease so important? Which according to important organ in the body?
Heart.
Anyone?
You can't live without heart.
So look, if the liver fails, you can still keep a person alive. If it fails means it partially fails, you can still keep a person alive. If you get a brain stroke, still a person can be kept alive. But if the heart fails completely, if it is, you have a heart attack and within 5 minutes, if you are not revived, you are dead. So in that sense, the heart is the most important organ to keep you alive. Is that okay? Yes. Right. So when, what gives a heart attack? When the arteries which supply blood to the heart get blocked partially, it reduces blood supply to the heart, and this leads to part of the heart muscle not functioning. So this causes some weakness. You get what is known as dyspnea, that is difficulty in breathing, and you get pain in the chest region called angina. This is if there is a partial block. And what happens if there is a complete block? It leads to death of that part. And if that part is large enough, so large that without it the heart cannot do its pumping properly, then you are dead. As simple as that. So it is very important to treat ischemic heart disease when it is a partial block before it goes to a complete block. That is why the reason we are here to discuss, so that we can treat patients when they have partial blockages and they don't have to undergo the ICU and all that things. And eventually, once they reach the ICU, then it's very difficult for you to get them, and then they go for angiography or bypass. So before that, we can catch them when they are like 40, 50, 60, 70. Even I have treated 98% blockages. So So let us have a quick look at the coronary arteries. So there are two main coronary arteries. I hope, yeah. So we can see there are two main arteries. They start from the top of the heart, and one is the left one and one is the right one. Right coronary artery and left coronary artery. Now the right one is very simple. It supplies a lesser part of the right atrium, right ventricle is not as thick as the left ventricle. This is the right ventricle. It's not as thick as the left. So less blood supply is required on the right side. So there are just two arteries there. There's a descending one, posterior descending artery, and a marginal branch of the right coronary artery. So there are just two of them. Whereas on the left there are three main branches. It starts with the left main coronary, then that leads to an important branch called the left circumflex artery, then which gives rise to the marginal artery and the left anterior descending. So these are the important arteries which are there in the heart. And usually the blockages in these left arteries, if a person is not so lucky, then he might have a blockage in the left main artery also, left main coronary, which is like he is in a big problem that time. But no worries, we can treat. For us, it's not a problem. Even for the angiography, this is much easier to treat because they don't have to reach too much inside. But for us, also it is fine. So what exactly is an ischemic heart disease? So when there is a gradual build-up in the blockages, so there is fat deposition here, and a plaque is not fat deposition on the surface, it actually goes under the surface. It goes under the endothelium, and it kind of bulges the endothelium out into the cavity, which makes it very narrow. And so this leads to less blood supply in the arteries, and because of which the person starts getting angina. Right? So, yeah. So, endothelium in the heart is meant to facilitate smooth flow of blood, and the plaques cause blockages in the endothelium. When the endothelium of the arteries gets blocked, that time what happens when the endothelium gets disturbed, like there's a bulge, like a speed breaker happening there. What happens when you are traveling by car and suddenly a speed breaker comes? You jerk like this suddenly. The blood doesn't have the brakes, it cannot slow down. So basically, when suddenly there is a block in the middle, it gets a turbulence, and this turbulence. So when suddenly there is a speed breaker on your car, what happens? Your car can swerve. It can even get damaged. It can damage the surroundings also. People standing, there is some railing or something, it can also get damaged. So this is exactly what happens. So when the endothelium is, the shape of it is changed and it becomes like a bump, the blood which is flowing, it gets turbulent. And this turbulence can cause damage to the endothelium also. So that is why these people who are having this kind of heart blockages are told to avoid very, very hectic activities which can cause increase in the blood pressure as well as increase speed of the blood, because this can cause more turbulence and damage that endothelium. And once this endothelium gets damaged, what happens when you get a cut on your hand or something?
Clot.
Yeah, clot. So the clot happens. So when the endothelium gets damaged, even inside, a clot can happen there. And this clot can take you from something as simple as a 40% heart blockage into 100% heart blockage within minutes. Within a minute or so, the heart blockage can go to 100% from simple 40, 30, 50, 60%. So that is why it's important to treat even these 40, 50, 60% blockage people. Otherwise, they don't have any much problem when they are doing routine activities. But suddenly, you find that anybody can suddenly be spurred into some hectic activity, like you're going nicely to some vacation and suddenly you find you reach the station and the train is just leaving, and you are not aware that your watch was 5 minutes behind, and then suddenly you're forced to run, and then suddenly what happens is your blood pressure rises very high, and that can cause the endothelium to rupture, and then you can suddenly get a heart attack. So it is very important that everyone keeps their arteries clean, and we'll see how you can do that. So yeah, this is what I was saying. When the endothelium is damaged, a clot can form on a pre-existing cholesterol plaque, and a person can get a sudden heart attack. So generally, what are the causes of plaques? Anyone?
fatty food leads to cholesterol, triglycerides.
When you take too much cholesterol or you take too much fat, or you're regularly eating a good quantity.
Stress. Sedentary lifestyle.
Stress, okay, but how? That you need to say. If it is stress, then how? Cholesterol I can understand because that's what is deposited there. Fatty acid,
Right. If you're not exercising, your blood vessels.
Dirty liver.
Fatty liver.
yeah. So generally it is understood that high cholesterol in the blood is what causes the plaques to happen, and because of which nowadays it has become a fashion that all cardiologists, and forget cardiologists, even the general practitioners sometimes, they are prescribing anti-cholesterol medicine, the atorvastatin and all those things, to even people who have some little heart pain, and even if their cholesterol is below normal. Forget normal. Even people below normal are being prescribed anti-cholesterol medicine. So we will see whether all this is correct or whether some change is required in this. So because it has been seen that blockages are occurring in spite of low lipid levels. We have patients who are absolutely thin, totally thin patients. Now, where is the question of having excess fat in the body? And if there is not enough excess fat in the body, and if the blood also report is showing it, not enough, not even normal levels, still the cholesterol is being considered as the villain. Whereas we should know that cholesterol is not a villain. It is actually a healthy, it's an important nutrient in the body, which is responsible for many things, including hormone generation, as well as the integrity of your nervous system. Because the nerves are, as you know, they are covered with lipid layer. So lipids are not something to be afraid of. They are not something to be shunned. They are not something that you negate as some villain kind of a thing and give anything and do everything in your possibility that you can eliminate it from your diet. So nowadays there are people who are prescribing zero fat diets. One very famous became famous later on. After Dean Ornish was the first one to talk about this fat-free diet, and after that, nowadays we have other people who advocate a completely fat-free diet. No one knows, I'm sure all the people sitting here are aware that there are basically three nutrients, major nutrients, macronutrients in the body. Anyone? Carbohydrate,
Fat,
protein and fats. So three major, they are important. This is what we are taught from school. And what we are taught from school can't be so wrong. The allopathy theories keep changing day by day, but certain things which we have in our tradition, it has been the tradition of India to always use ghee in food. So when in allopathy we started learning all these things, what happens is your faith in your traditions tends to, you lose that for some time at least, till you become wiser. So it is important to stay rooted in our traditions and understand that if some new fad is coming up, you have to first see how long that fad lasts, and then you start following it, not blindly. So we have seen, it is very clear, I'm sure you also have seen, probably wondered, how come this person has a heart blockage although his lipid levels are so low? So this is what I was saying. There can be two people, one so thin and one so fat, and this fellow who's eating just one cheeseburger, and this fellow is hogging God knows how many. Possibly there is a possibility, and you cannot predict exactly at this moment without examining their doing their pulse examination or other things. But this fellow, it is possible that he may die while crossing the street, and this fellow may go nicely jollily. So my question is that if fat was the cause or the main cause or the only cause of heart disease, how did this person reach this level? Obviously, at some point his fat levels must have been, lipid levels in the blood must have been high. The way he's hogging, immediately after eating, at least they are high before getting sent to the storage places. So how is this person even surviving? And how is this person who's so thin and meagerly eating just one cheeseburger dying? We have seen all this happen and wondered how this person, every day he used to go for a walk and used to have a very strict diet, and yet he died of heart attack. Nothing is certain in life. We become philosophical. Life is so uncertain. But everything is science. Everything can be explained by proper science, and not just the so-called the modern science, which considers itself to be the only science. We acupuncturists know that there is metaphysical science, which explains many things which allopathy cannot explain, right? So we know, and that's what we are going to learn. So, yeah, so when I was doing research on these patients, a very interesting, very shocking revelation happened. I took out my physiology books, anatomy books. I started just seeing what exactly is happening there. So what I found, I will just go to the next for a second. So what I found that there is something called a thoracic duct in the body. And what is this duct? This duct, what it does, it takes fat from your intestine and takes it all the way to the left subclavian vein. And left subclavian vein is just like one gully which directly enters into the heart. It enters the main road called the vena cava, a gully which enters the main road called the vena cava and directly enters the heart. So this was really very shocking for me. For some days, my faith in God was shaken. I said, is God some kind of a sadist? Why did he design us like this? Why did he design us for a heart attack? Why is the blood going this fat going directly to the heart, whereas everything else goes to the liver? Every other thing you eat goes through the portal vein into the liver, and only fat goes directly to the heart. And I said, this is not fair. I asked God, what I won't use those words, but what is going on? How did you design like this? You should have asked me, at least. I would have told you a better way to do it. But then I said, no. I had a long history of spirituality by then, so my faith was not, it was just stirred, not shaken. And I studied more. And what I realized, first let us see now. This is what I just said. Everything goes, all the fats go to the heart, and everything else goes through the liver. So in the liver, things are detoxified, they are metabolized, safe for the body. But these fats go directly. So it is as if we are designed for a heart attack. So you see this is the main so-called culprit in this case. Now, then I studied physiology, and what I found that actually the heart muscle is designed to use only fat as its fuel. Main fuel of the heart is fat. Now does it make sense? God is not a sadist, nor is a fool. is the most intelligent being in the world, in the universe, in all the universes and beyond. So he has designed us perfectly. It is we the ones who mess up things by wrong behavior and wrong habits. He is not at fault. So heart muscle has been designed to work constantly, and as we know, when we are doing, say, cardio, anyone exercising here, having some knowledge of exercise physiology. So what exactly is cardio exercise? When we say cardio exercise, what do you mean? Pardon?
Cardiovascular pumping.
Cardio.
Yeah, but like in actual technique, what is the difference between regular exercise and cardio exercise?
Heart pumps more in cardio.
Heart is
Cardiovascular
allowed to
pumping
increase to a certain level, which is like something like 200 minus your age, and that is considered your optimum heart rate. And if you exercise at that rhythm for say half an hour or so, your fat burning happens, right? This is what is told. This is what the physiology, heart exercise physiology teaches us. So what does that mean? That means that something that is working constantly better uses fat as a fuel, not carbohydrate, not sugar, not glucose. You're understanding this? So when something has to work for a long time, fat is the ideal nutrient for it, the ideal fuel for it. And therefore the heart has been designed, the body has been designed so that the heart can receive fat constantly. Or it can, in one sense constantly, and immediately even after the food, it first goes to the heart. Because heart works on fat. Are you in a state of shock or what? It's something new, right? Everyone, all the time we are told that fat is the biggest enemy of the heart, and suddenly we come to the understanding and properly scientifically backed understanding that fat is actually the fuel of the heart. And if fat is the fuel of the heart, then why does fat cause blockages in the heart? Yeah, so what is bad fat, what is good fat? We'll see that. We'll see what is like exactly what of bad fat does exactly. Yeah, so this is a chylomicron cycle. I'll give you 2 minutes to read it. Or if you want longer, or if you want me to skip it, I will skip it. Basically the lowest parts of the fats, the smallest parts which are taken from the intestine and which combine with this apolipoprotein B48, and they form larger chylomicron, and this whole thing goes to the thoracic duct and it goes into the heart where it gets metabolized. So heart is actually metabolizing the fat. So again, when we are doing more cardio, we are burning more fat, right? Because the heart is the main burner of the fat. We always look at the heart rate when we are burning fat. Because larger the heart rate, larger the metabolism of the fat, right? Okay, so what is the real cause of plaque formation? Now we are really coming to the main lecture. So it has to be concurred that the blockages occur due to some causes roughness in the surface of the arteries. So when you see that when it doesn't rain too much, when there is famine, there is drought, what happens? You see the ground, how it looks? Anyone?
Crack.
So why is that?
Because of dryness.
Dryness. So because of dryness causes cracks. So when you have dryness in the heart, it will be there occur cracks in your endothelium. Is it clear? These cracks are what attract the deposits of the cholesterol and the fats, and then the endothelium grows over it, and again it cracks, again more deposition, again more. As it starts growing, it becomes more prone to be cracking. When it is flat, there is less chance of cracking. When it grows like a bump, it cracks more. So that's how the heart blockages start growing very fast. you're not careful. So in acupuncture we know, so now we are coming to etiology. We studied the studied the etiology, we studied the pathogenesis, right? We are studying the pathogenesis now. So what happens, and this is the reason. To understand why this is happening, we have to understand the real causative factor. So in acupuncture, we know that actions are causative factors, right? Isn't it so? We are told in acupuncture that emotions are also a cause of disease. Okay. All on the same page? Okay. So we know that emotions are causative factors and heart is the seat of emotion. Any doubts? So whenever the emotion changes, the heartbeat changes, right? Sad people are supposed to have very low heart rate. And people who are excited, happy, they have high heart rate. So heart is a heat energy and sadness is heart is made of heat energy or the fire element and sadness is the dryness energy. So when there is emotional dryness, it creates a dry situation in the heart and causes roughness of the endothelium, which causes fat to deposit and create blockages. Any objection? Can you agree? Yes. Okay. So fat is earth element, which is the son of fire element. Since heart is fire, we know the 5 element cycle. Earth is the son of fire and excess earth can reduce the mother, can weaken the mother. So excess fat can weaken the fire of the heart. For example, it's very simple, like you have a fire and you put ghee, what will happen? Because the fire will burn more. In the yajna, if you have attended any yajna, whenever the priest puts in more ghee, suddenly the fire get a blazing fire. But suddenly if he gets a little bit disturbed and he wants to finish it fast and he puts the whole lot of ghee into the fire, then what happens?
Diminish.
Fire is gone. So that is what has happened. If too much fire is the ghee helps the fire, but too much ghee can destroy the fire, right? So fat, although it is the fuel for the heart, too much fat can weaken the heart, right? Yeah. So this is the 5 element cycle, and we will just see how that happens in a little more detail. So you have dryness energy here, which counteracts the heart, the heat and fire, right? It's a counteracting. Too much of dryness can dryness and all the elements exist in all the organs, right? So without dryness, there is no possibility of any structure. But too much dryness will cause the structure to crumble by making it cracks, by developing cracks. So cracks happen in the heart linings and that causes this fire that weakens the heart in that sense. Because what happens then is that the fat which is floating in the blood will cause deposition here and block all the arteries. And arteries, when I say arteries, it's not just the 5 arteries which I showed you in the diagram. It's not just that. Right? There are more. What are they? They are the small arterioles which enter into the heart muscle. They are not listed. So those are also very important. They can get damaged also by the fat. They can get damaged by the dryness. They get damaged. They are the ones which get damaged when a person smokes. Sometimes smokers, sometimes they don't show any heart blockages in the major arteries. When you do an angiography, you don't see those blockages in the heart, and yet they have angina. So this is because of those arterioles which are entering, they are blocked. Those are not seen. Those are not seen on the regular angiography. For that you need other techniques to see them, the radioactive techniques which can show us. Yeah. So what happens? Sadness we can consider as the main energy, which causes heart problems. Because what happens is sadness reduces the pumping of the heart, right? When you're sad, your heart is not very fast. It slows down. It's known thing. And indirectly by although overall metabolism can slow down in sadness, and also the vagal tone increases in sadness. So it further reduces the heart rate and less fat is utilized. So when sadness is directly damaging the heart, we saw that, the dryness. Sadness is also reducing the metabolism, slowing down the heart rate, so reducing the heart metabolism of fat. So fat is going to increase, right? So some people, when they are depressed, they eat more, they don't work out, they don't move around, and they become fat. Some people don't eat, they are safe. They are safer. So they don't eat, there's no fat. Or if they eat something, or maybe if they are lucky, they eat some regular vegetables and stuff, then they are okay. Then they don't die so fast. But those who are sad and who are using food as a comfort factor, and using fatty food is the most comforting, right? So fatty food, if they eat, they are likely to develop more heart disease. The fat levels will increase, and already the dryness is there, and fat levels are high. So then this fat enters those cracks, and you get what do you get? The plaques. So what is now the final part of the this lecture? Is the acupuncture treatment, and after that the treatments, other treatments also we will talk about. So this is the treatment protocol. So this lecture is supposed to include etiology, pathogenesis and treatment protocol. Now we are on the treatment protocol. So this is what we are supposed to do. We are supposed to sedate the dryness, the metal element. We are supposed to tonify the fire in the heart meridian, the heat point in the heart meridian. And we are also supposed to, this will work directly on the heart, and it will work on the small arterioles which enter the heart muscle. Okay? Whereas we see now what to do about the blockages. What organ rules the arteries?
Small intestine.
Right. So we work on the small intestine to treat the arteries. So sedation of humidity from small intestine, the earth element from small intestine, and we have to tonify the wood element, which is the wind element, energy. In case of calcification of plaques, now types of plaques, some are just the fatty plaques and some are the ones which are calcified. So in case of calcification of the plaques, it represents the coldness energy, and we have to reduce that from the small intestine. So water point of the small intestine has to be sedated in this case. So this is the actual points which we use in the treatment. So H4 sedation, H8 tonification. H4 is the dryness point or the metal point. H8 is the heat point, the fire point. In the heart, we will also sedate S8, which is the humidity point, and we will tonify the wind point, which is the wood point, which is S3. We will also use P6 because P6 helps to balance energy in the chest. So these P6 and all other points is what I used to use in the earlier days. I still use, but these were the points I started with when I started treating heart patients. Then, as we know, what happens once it goes to the heart, after that, fat does goes to the liver. It has to go. Everything has to go. So everything, when it goes to the liver, what happens? The liver is also responsible for fat metabolism. And if the liver is weak, people develop fatty liver. So fatty liver means that the liver is weak. You have to strengthen the liver. So how do you do that? So you sedate liver 3 and you tonify liver 1 in this case. And you also use points like SP6 and P3 for balancing the spleen, because I had seen one patient who had a triglyceride level of something like 2000 at one time, And when he came to me because of medicines and other things, it was already something like 800 or 1000 or something. So when I checked his pulse, I found that he had a problem of the spleen. The spleen was damaged. There was coldness in the spleen. So I treated that, and within short time, all this the fat got removed from the blood. It went back into the spleen. So because the spleen is what destroys your RBCs and other things, and we know that almost every cell of our body is made up of phospholipids. So lipids get released, and the spleen, if it's not able to control these lipids, then these are just sent into the blood and they create high levels of triglycerides. So this is also important. So in case of blocks, in spite of low lipid levels, I said that thin man, he might also suffer a heart attack. So he might not have high levels, but if he is the one who is having a heart problem, then what we have to do in the earlier case, what we did, in high lipid levels, what we did, we reduced the humidity from small intestine. Here we will reduce dryness from the small intestine. Because here the problem is the excess dryness of small intestine, which is giving rise to cracks in the endothelium and which is allowing the blocks to happen despite a low lipid level. So in this case, sedate dryness in small intestine. So you sedate SI1 and you tonify SI3 to increase the fire. So yeah, other treatments, because as sir says, myelopuncture is important, also other things are important like diet, lifestyle. As acupuncturists, we are not simply there to put needles. We are also supposed to advise people on good diet, because diet is also part of acupuncture, and diet includes everything that goes down your throat or into your mouth. So smoking, you have to tell them in your diet smoking is not allowed. Right? Why? Because smoking, tobacco in any form, whether it's the tobacco chewing or the smoking, it causes dryness in the body, including arteries, and microcirculation of heart muscle gets compromised first. The small arteries, the arterioles, they get compromised first. And avoidance of both fried and dry baked foods. Now, as I said earlier, there are people who are giving fat-free diets, completely fat-free. So that means not only not eating oil as such, but also not eating those foods which contain oil, vegetables or other things which contain oil. So this kind of a dry food, this baked, the concept of having baked food, it is frowned upon in Ayurveda. Ayurveda says that baked foods are not good, something which these people need to be told. So baked food, why? Because it causes dryness. And why dryness is bad, we have already seen. So dry fruits and nuts should be also avoided because they have dryness. The nuts have fats in addition. So you are giving like, okay, a package deal, okay, this, take this, have this, you'll get a nice heart attack. So, on the other hand, grape juice, red grape juice is best because it contains flavonoids and heat to combat dryness in the system. It is very good. Instantly a person can get relief in heart pain, angina. If you tell the person to have red grape juice, instantly it can avert a heart attack. Instantly. So dark green leafy vegetables, rich source of folic acid, reduces homocysteine levels. Homocysteine is, I think, one of the biggest villain. This is actually a villain, not the cholesterol. This causes actual blockages. So it damages the endothelium of arteries, leads to deposition of fats and plaques, also increases the risk of forming blood clots. See how important is green leafy vegetables. Green leafy vegetables give you folic acid, will reduce homocysteine, which is the real villain, not the fats. So which are the sources? Spinach, broccoli, Brussels sprouts, asparagus, etc. So in homeopathic medicine, we have got something called cratagus, which also helps. Because it helps in two ways. It helps to clear the blockages, and it also increases the heart rate by strengthening the heart. In Ayurveda, we have what Arjuna Rishta, which has the same effect. It strengthens the heart muscle. Now, just by strengthening the heart muscle, you can cause it to metabolize more fat. And when something is metabolizing, supposing if I am hungry and there is food kept here, what will, if I hope you consider me to be of sound mind, and if I am of sound mind, will I eat this or will I order something from outside? I am very hungry. I can't even wait. Will I eat this or will I order by Zepto? What is that? Tomato. I will eat this, right? So when there is blockages in your arteries around the heart and the heart muscle is hungry, what will it eat? Will it eat that fat? Exactly. So heart is intelligent. Yeah. So the Akshasam is also very effective with this. Beta blockers, yeah, let's talk about this. Generally, we have this disclaimer kind of thing. I am an acupuncturist. For your medicine, you go to your allopath. Whatever he says, I am no business to talk about anything. Whatever he is giving you beta blockers, obviously good for you. So, okay, you as legally, it may be prohibited for you to interfere with the medicine, but you should have the proper understanding at least what is going wrong, why you're not, if you're not getting the results which I am getting. I am getting very good results, but because I am being an allopath, I have the right to tell the patient that you need to stop this, you need to stop your atorvastatin, this, that, you need to stop your beta blocker also. So let us understand why. Now beta blockers, what they do? They lower the patient's heart rate. And what we saw in cardio, what you are trying to do? Increase the patient's heart rate. Of course, allopaths are not the villains here. They are doing it for a good reason. They say that if your heart rate becomes too high, you suddenly go for a run after the train or somebody else, whatever. So, your heart rate, if it suddenly increases, your oxygen demand will suddenly increase. And then, if your arteries are not able to supply that, then you will suffer a heart attack, which is totally logical and proper. Right? Right? So, beta blockers are given for a good reason, but they also interfere with the process of clearing the arteries, because the person is going for his cardio, but your heart rate never increases to that level because of the beta blockers. So what is your cardio going to do? So they have to be kept, depending on the patient's condition, they have to be given minimum required, and when they are not required anymore, they need to be removed. They cannot be just given just like your ecosprin. Ecosprin is fine, there is no issue with that. Okay, your blood will not clot if you take this. But the same cannot be said about beta blockers, because beta are reducing your heart rate, which is actually helping you to burn fat in the heart itself. So you need to tell your patient that just see if your heart rate is now normal, and if you are maintaining a good heart rate throughout the day, just see if your cardiologist allows you to reduce it. Right? You can do that much at least. So, as the heart functions on metabolizing fat, lowering heart rate results in reduction of fat catabolism, and hence a fat buildup in the body and coronary arteries. They should not be given unless a person is really having very high heart rate. Every now and then his heart rate is going to 100, 120, 140. Such people definitely need to be given to keep them safe till you reduce the blockages in their heart, and then you may tell them now you're almost okay, you may start reducing. Yeah, so nutritional supplements also are useful, like bile salts. Bile salts, they emulsify triglycerides, they dissolve. So why they are not being used? They should be used. Then soluble fiber in the cholesterol and excreted to the gut. So all these things are also useful. Emotional factors, watching sad movies and stories, reading sad stories should be avoided. Patient should remain cheerful at all times. You see how that girl is dancing? That's how you should tell your patient to behave. This will cure them of heart disease. They say laughter is the best medicine. Why? Because laughter creates joy, joy creates fire, fire helps to burn your fat. If necessary, counseling should be resorted to correct disorders in thinking process and help persons overcoming, because no matter what you tell them, they are sad for no reason or not a good reason enough. If they are sad for a good reason, that good reason also goes away after some time. Somebody bereaved, is bereaved, some loss, death in the family. That is supposed to not last beyond 6 months or so, maximum. After that, a person is supposed to go back to normal. If he doesn't, then he is sitting duck for heart attack, or she. So like in yoga, you can do Nadi Shodhan Pranayama, as the name suggests, it helps to clear channels in the body. Sarvangasana, Chakrasana, Ardha Matsyendrasana, these are also very good. They help in improving the heart circulation. And gradual increase in walking and other exercises. If somebody comes to you who can't walk 5 steps, I had patients like that, who couldn't walk even 5 steps without panting. And after say about a month, that person started walking from Bandra to Mahim and back. He used to had his hotel in Mahim, started walking from Bandra to Mahim and go back again in the evening. So this kind of improvements happen in such a short time, which are not seen by any other method of treatment. Not homeopathy, not Ayurvedic, not diet, but acupuncture along with everything gives you this kind of results. Exercises, aerobic exercises, and those which stretch your heart meridian. Your heart meridian is here. Any exercises which stretches your heart meridian, that can help you a lot, other than the cardio exercise. All the meridian exercises can help you. Different yoga poses, especially those which create either improved blood supply to the heart, the inverted asanas, or those which stretch your heart meridian. They are useful. So with such measures, it's completely possible to cure. I think this PPT was written much, I think, more than 20 years ago. Now the results I'm seeing are much faster. It's between 1 to 2 or max 3 months, and people are out of danger in 4 days. Somebody who's like imminent heart attack, he's like, if he doesn't do anything, 4 days he's going to get a heart attack. Those kind of people, 4 days of treatment in this way with all the other measures, you take him out of danger in just 4 days. So it's not like he has to be very careful, very careful for 3 months or something. In 4 days he's out of danger, because you have now reduced his, improved his circulation, which was blocked by 98% block. It suddenly within these 4 days you can take it to say 90 or so. Because that what happens last goes first, and that is faster. After that, it may be a slower process. So the old patients, which I have not changed it, it's been there for a long time. I have not done much changes to this PPT. So this you can see, this is the before and this is the after. You can see how much change there has been in the arteries. Right side has not shown so much change because people, they generally, when they are having a heart problem, what happens is a lot of collateral circulation develops from the left side to the right. Left being the dominant side, it's like I'm the boss here, I will take over. So it starts giving more blood to the right. So right artery is not that much required at that moment. So that's why left one opens first. The collaterals are already working on the right side. Sometimes the right one does not show that much improvement. But still this is an old one, and we have better results now. You can focus on both sides and give treatment, and it helps to clear both the sides. Yeah. So what is the conclusion? The conclusion is that heart attack because of heartbreaks. So don't give heartbreaks, karma will get back. The safest place for to keep your heart safe is to give it to God. God will take care of your heart. Thank you.